Okay.
And this one comes out on the weekly this month.
Yay! Hi, guys.
Hi. So this one's our monthly recap on the weekly. Because typically these would go on Patreon, but we're trying to entice you guys to become more patronuses, more patrons.
More patronuses.
More patrons, because you guys are missing out. We just recorded our 31st episode on Patreon.
Woo-woo!
Okay.
31st.
And it was amazing. Well, by the time this comes out, you'll know. It's MK Ultra, guys. We did a whole hour-long episode on MK Ultra. It was awesome. It's probably one of my favorite episodes we've done thus far.
And MK Ultra can definitely have more than just an hour material.
Yeah.
But we focused more on the
medical.
Yeah, like LSD, hypnosis, barbs, all that stuff.
All that crazy stuff that was happening. The mental control.
Yeah.
All of that. So check it out, guys. Like, honestly.
And actually, I had never heard of MK Ultra until you brought it up.
Are you serious?
Yeah, never heard of it.
Dude, with how much you like Stranger Things?
I know, I never heard of it. I know.
Yeah, but check it out. But anyways, we're here giving you still a taste of what, patrons have. So we're going to talk about the month of March, the medical recap news, at least some of it.
Jules knows that these are my favorite episodes to do because they're like new things and news and stuff like that. Just stuff that's just
trending.
It's trending, but it's medical related. Nothing of like heavy, teaching points or anything like that. It's just more conversation, and this is what I love about it.
Exactly. And there are a bunch of different topics about everything because that's the news.
Yeah.
Start off, Doc.
All right. So for the first thing on March recap, mapping dysfunctional circuits in the frontal cortex using deep brain stimulation by Barbara Hollander et al. I always say and her friends. And her friends published February 22nd, 2024 in Nature Neuroscience. So,
and again, like, it's for the last month. I know we name it March recap.
Yeah, but it's what came out for the last month.
Yeah, because it's kind of, we're recording this right now on March 23rd. So clearly there's more stuff that's going to come out on the month of March. But yeah, this is it. So.
All right. So the recent study offers Okay, so the recent study offers groundbreaking insights into the brain's circuitry and implications for various neurological disorders. So by analyzing data from 534 deep brain stimulation electrodes, implanted in the patients, the researchers were able to identify specific circuits in the frontal cortex that become dysfunctional in disorders such as dystonia, Parkinson's, Tourette's, and OCD. So the study found that these dysfunctions are topographically organized from the occipital to the frontal regions of the brain, all right, from the back to the front, with each disorder associated in specific areas.
And occipital it works with your eyes, with your vision.
Yes, that is one of the cortexes, the visual cortex. Okay,
I'm here for the brain, so I'm gonna let you know.
Jules is the brain girl. So, for instance, dystonia was linked to sensorimotor. For instance, dystonia was linked. Guys, I'm sipping more Celsius. Okay.
We're here.
For instance, dystonia was linked to sensor motor cortices, Tourette's syndrome to the primary motor cortex, Parkinson's disease to the supplementary motor cortex, and OCD to the ventral medial prefrontal and anterior cingulate cortices. Jesus Christ, Julie, did you put this in on purpose?
No.
I was literally just talking to Julie about how there's so many freaking cortexes in the brain.
It's important news. It's treating Parkinson's and Tourette's.
I'm like, cortex, blah, 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 cortex. Blah, 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 cortex.
Came on Nature.
Cool. All right. Anyways, so what did these findings show? So these findings have significant implications for the development of targeted neuromodulation therapies, potentially leading to more effective treatments to complex conditions. So what does this do? This basically puts electrodes, right, that are placed into your brain, and then they start studying like the signals and basically that connection between these cortexes, So people that have these problems like Parkinson's, OCD, and everything, they can potentially have this neural mapping, to see if there's any targeted therapies that we can do to help them, which is pretty incredible, I
thought so.
Yeah. So the integration of deep brain stimulation with brain connectometics, okay, is highlighted as particularly effective method for exploring the relationship between brain structures and the functional impairment, marking a substantial advancement in the field. So what I kind of like think about this is, you know, acupuncture. So you do your acupuncture points, and then that is supposed to exhibit relief of symptoms or trigger some sort of certain organ or dysfunction, right? So this is kind of doing the acupuncture for the brain.
Yeah, that's a great analogy. Exactly. Anyway, this one has been all over my feed in every social media platform that we are in, which is every single social media platform almost, basically, out there. Check us out there. Funny Medicine. Anyway, so ultra processed foods linked to 32 health problems. What to know? By Rachel Panett on February 29th, published on the Washington Post. The article highlights a comprehensive review of research involving nearly 10 million people. So very comprehensive review, which found a direct link between the consumption of ultra-processed foods and over 30 health conditions. These conditions include heart disease, anxiety, and an increased risk of early death. Ultra-processed foods such as certain breads, cereals, snacks, and frozen meals are industrially we're having this moment, okay?
Yeah.
We're having it together today, okay?
Yeah.
It's
Jules
usually
and I are on
just
the
me.
same level.
It's usually just me, but you know, whatever. Anyway,
Not alone today.
yeah. Manufactured and often contain flavors and additives to enhance palatability. So enhance its taste. The review underscores the potential health risks associated with the diet high in these ultra-processed foods. So guys, try to stick to whole foods.
Yeah.
Not to stick to the ones...
Shelf life.
Exactly.
Yeah. So you want to stick to the ones on the periphery, which is like the fresh projects and not the aisle ones.
That's exactly what I meant.
Yeah. It's so hard because we live in this world where processed foods is like the thing, and
shoved in our faces.
It's easily accessible.
Yeah.
It's cheap.
Yeah.
It tastes good. It's so crazy. So I did 1 year, right, of no fast food.
Okay.
It was a little bit over a year.
Okay.
And then whatever, I broke it for something stupid. Like I was on a road trip and I'm like, screw it. Like I'm gonna whatever, grab something because I'm starving, right? Girl, there's something in those foods because it was just like a spiral. It was like this like thing, like, you know, I don't know. I probably have some sort of like eating disorder or something. No. But it like sparked this thing that's like I had to have like fast food again.
I mean, there's so much chemicals that go into it.
Yeah.
So many chemicals
100% there's something addictive there that like keeps people coming back.
There has to be.
Yeah.
There has to be. I mean, you know how they say it like in McDonald's fries that they have something in them.
Yeah.
And it's true. You can't have one McDonald's fry.
Yeah. And it's so funny for all my Bluey people out there, for our parents out there. So Bluey, right, this little dog is like sitting next to her dad, and then her dad, they just came out with this episode, and the dad has ketchup, right? And then Bluey has her own ketchup, right? So she puts, by the way, there's like, you know, Bluey's a girl.
I didn't know that.
Yeah. I'm pretty sure Bluey is a girl.
I thought Bluey was a boy. And then my son, I'm trying to get him into Bluey, but he just refuses to get into Bluey, which has made me sad. But one day I will get him into Bluey.
Bluey's a girl.
All right.
Yeah. So she's next to her dad, and then she pours her ketchup, and then her dad pours her ketchup, and then she asks her dad, she's like, why do you have a different ketchup than me? And she's like, or tomato sauce. And then he's like,
yeah, because they're like, Australian, right?
Yeah, exactly. They're Australian. And then he's like, well, it's because yours is healthier, it has less sugar. And then she just like looks at her tomato sauce, and she looks at his tomato sauce. And then she's like, I want to try your tomato sauce. And then he's like, no, like you can have like yours. And then she's like, just a little bit. And then he was like, and the dad's a really funny personality. And he's like, okay, well, just a little bit. Yeah. And then he gives a little bit, and she like eats the hot dog with the tomato sauce. And then she like just looks, and she's like, I want that sauce. She like becomes like a different like a completely different personality, like obsessed. And she's like, I want your tomato sauce.
Oh my God.
And that's what I felt like.
Yeah.
When I was Bluey in that moment, I ate it, and I was like, I want fast food. I was like a different person. So yeah, guys, there's definitely something in processed foods. Just stick to whole foods.
Yeah, try to stick to those. Exactly.
Have you ever done Whole30?
No, I haven't, but I want to.
Yeah, I did Whole30. I've done it twice already.
It's kind of hard living with a Cuban mom and telling
but
her
you
that
can do
we're
it.
Gonna do
the first few days are really hard, and you feel like you're eating the same shit over and over and over.
I'm sure.
But it's actually really, really good.
Yeah, I'm going to give it a shot. Yeah. Like, I really am.
And now with TikTok, I didn't have TikTok back then with Whole30.
I know.
You have plenty of ideas. Okay, so next up. Helpful gut bacteria seem to reduce allergic disease in kids by Lydia Denworth on March 1st, 2024, published on Scientific American.
Check out our mind-gut connection episode.
Yes. So the article from Scientific American explores the connection between gut bacteria and the reduction of allergic disease in children. It discusses the right combination of gut bacteria in infancy might prevent allergies later in life, and scientists are investigating cocktails of beneficial microbes as potential therapy. So the piece highlights that the study of over 1,100 children, which found that those with disrupted microbiomes at the age were more likely to develop conditions such as eczema, food allergies, allergic rhinitis, and asthma by the age of 5. The presence of specific bacteria such as Bifidobacterium infantis which is more common in breastfed children, has been shown to protect against developing asthma. Okay. The article underscores the importance of microbial exposure in early life in shaping the immune system and suggests that restoring certain microbes could reduce the prevalence of allergies. So this has been something that we've already been seeing in the works.
I mean, this is perfect for you.
Yeah, exactly. I've kind of already been telling, parents, like, we really feel like this is diet induced. Mm-hmm. But imagine we don't have
the concrete
a lot just yet. I feel like we will really soon. But we don't have anything concrete right now. But I'm so happy that there's more things coming out in our diet and what we put into our children.
Yeah.
More evidence on why breastfeeding is so beneficial. It's like we already have a plethora of reasons why breastfeeding and breast milk is great, and then now we have more evidence, and it could give us more insight on why kids have this.
Because it's such an
and for anyone that has kids with eczema, Julie and I both deal with it.
Well, thank God not anymore, but when
I
he was a baby,
still do. And Nora, oh my God, terrible. He got
over it.
It's frustrating. It's extremely frustrating. And I get so many parents, and then I feel like the parents are like, "You're an idiot," because it comes and it comes again and this and that, and I'm just like,
that's how it is.
That's how it is.
Yeah, And then I always go back to the mind gut connection episode that we went. You talked about a patient that every time your patient would go to Germany, the flare-ups would just
go away for 2 months completely.
Jeez.
And a girl with severe eczema, I would say.
And then as soon as that little girl would come back, flare up.
Yep.
That's insane. That's like such a blatantly obvious connection right there.
Yeah, for sure.
Anyway, so which is scary too. Yep. How it's clearly your body's like, there's a problem. There's a problem. You're ingesting a problem here. Yeah. Anyway, so the impact of isolated obesity compared with obesity and other risk factors on risk of stillbirth, a retrospective cohort study. I mean, I don't know how many times I've actually said that word, but now
I'm like, you've said that word so many times.
So many times.
But you know what? Sometimes words, you just say it and it sounds weird to you.
Yeah, because I'm having a day anyway. It's a migraine. Anyway, so by Nilia Ramji and her friends. On March 4th, 2024, published on the Canadian Medical Association Journal. So the article examines the relationship between maternal obesity and the risk of stillbirth. The study analyzed data on 681,178 births in Ontario between 2012 and 2018, including 1,956 stillbirths. It found that class 1 obesity, which is defined by BMI of 30 to 35, was associated with an increased incidence of stillbirth, with the risk being higher for class 3, which is defined by BMI of 40 or higher obesity. And the actual highest was in between these two, which was for class 2, BMI of 35 to 40 obesity. Yeah. So the risk of stillbirth increased with gestational age, particularly beyond 37 weeks. So the study concluded that both maternal obesity alone and obesity with other risk factors are associated with an increased risk of stillbirth, and the risk escalates as term gestation continues.
Yeah.
So very
there's
interesting.
So many risks with obesity.
Yeah. Huge.
Premature labor, stillbirth, just a lot of things that can happen.
100%.
Gestational diabetes. Mm-hmm. So it's a problem.
It is.
And it's a problem in the U.S. I'm
huge.
I'm not the first person to tell people out there.
No.
The United States and obesity, it's a pandemic.
It is. And I know that this was Canadian Journal.
An endemic, whatever. It's a freaking problem. It's a disease.
It's a problem in the U.S.
Yeah.
And I know that this was a Canadian journal, but still, it puts a big spotlight into something that a lot of people are now in the US specifically. They're like anti-abortion, all this bunch of BS, in my opinion. Anti-abortion and all that is BS. And yet we're still dealing with these problems during pregnancy. So it's like, can we tackle the problems instead? You know, like let's do that for the moms. So then you could actually have the babies and all that, you know, but what do I know, you know? Anyway.
So type 2 diabetes risk may be higher in people with shorter sleep duration. Okay. By Eileen Bailey on March 5th, 2024, published on Medical News Today. So the article reports on a study suggesting that individuals who sleep for 5 hours or less per day may have an increased risk of developing type 2 diabetes. The study, published in JAMA Network Open, used data from UK Biobank involving 247,867 participants aged between 38 and 71. So here are the key findings. 1. Sleep duration. People with sleep durations of 5 hours or less had higher risk of type 2 diabetes. 2. Diet and exercise. A healthy diet did not lower the risk, but daily exercise might decrease the risk of diabetes and offset the effects of insufficient sleep. 3. Sleep increase. Increasing daily sleep to 7 hours might reduce the risk of developing type 2 diabetes. So not just, you know, maintaining your regular risk, but decrease that.
Yeah.
Okay. And then 4, challenges. Factors like work schedules, childcare responsibilities, health conditions, and economic pressures can make it difficult to achieve sufficient sleep. The study highlights the importance of adequate sleep for preventing type 2 diabetes and suggests that improving sleep habits could be potential strategies for reducing the risk. So these are one of those studies that it's like, okay, well, did we need any more evidence to show that sleep is so important? Sleep is so...
Check out our episodes on sleep.
Yes. Sleep is important for health, everything, mental, physical. I mean,
and then also how exercise is so
exercise,
important. It can offset that. Like that's
and exercise, like that is one thing that has been shown to, if there's one thing, yes, you can diet and all of that, but exercise has been shown to decrease your insulin resistance, which ties in perfectly into diabetes. So yes, sleep. You need it. Who gets 5 hours of sleep? Even I. Oh, Jules.
Sense the migraine.
I know. God, guys, pray for Julie. Okay.
Yeah.
I'm going to start a hashtag pray for Julie.
Last night it was like 4 something in the morning and I'm just here like,
oh,
it's
no.
my life now.
Thank God. Oh my God. Knock on wood. Yeah. I never want to lose my sleep.
Oh no. My sleep is like.
The only time I lost my sleep was with Nora when she was a newborn.
Yeah. Oh, for sure. Yeah. My sleep is something that's hard to attain. It's just wonderful. Anyway, so higher blood caffeine levels linked to lower obesity and osteoarthritis risk by Corey Plack on March 5th, 2024, published on Medical News Today. The article discusses a study that found higher levels of caffeine in the blood may be linked to a lower risk of obesity and joint diseases like osteoarthritis. So I guess you and I are solid in that. So researchers from Imperial College of London, because I will get barked at for not saying that correctly. So researchers from Imperial College London and the University of Copenhagen. Honestly, Copenhagen was beautiful.
Yeah.
You've been to Copenhagen, right?
I've never been to Copenhagen.
I thought you went when you went to that European trip.
Nope.
Damn.
I went to Prague.
Oh, okay. Yeah. I haven't gone to Prague. I want to go to Prague.
Germany. I went to Germany too.
I went briefly to Berlin and I want to go back to Berlin. Like there was so much to see.
We did Munich, but Berlin is like very historic.
That's why.
Ton of history.
Oh my God. There's a whole island that's just Museum Island in the middle of Berlin. Like I'm like, I need to be there. Anyway, so conducted, wow, my ADD like really just like reared its head hard right there. Anyway, so conducted the study which suggests that caffeine's protective, which, hold on, ADD just kicked in again. Somebody had said that we say caffeine like pretty funny.
Caffeine?
There you go. You say it correctly. I say caffeine.
Yeah, I noticed that you say caffeine, but you say a lot of different words differently.
I hadn't realized that until somebody on Threads was like, you say caffeine in the funniest way. And I'm like, caffeine. I'm like, oh, I say it with an E instead of caffeine.
Yeah, caffeine.
I say caffeine.
Oh, Julie. For those of you listening, y'all know Jules and her words.
My words. I do better writing them than saying them.
Yeah,
so.
I know. Yeah, she's a fantastic writer, actually.
It's an enigma. But anyway, that's me. Anyway, so suggest... Caffeine.
Oh, you see, I can't even say it like...
Caffeine. I'm trying to correctly say
caffeine.
it.
Yeah.
Caffeines. Caffeines. Protective effects against obesity and joint disease are influenced by both consumption and genetic factors that control metabolism. The study utilized a genetic risk score based on 2 genetic variants associated with plasma caffeine levels to explore the relationship between caffeine and various clinical traits. The findings indicated that long-term increases in circulating caffeine could help reduce body weight and risk of osteoarthrosis and osteoarthritis.
Yeah.
Additionally, the study confirmed previous genetic evidence suggesting a protective effect of plasma caffeine against obesity risk. So, Yvette and I are solid with that. Celsius, sponsor us. Pretty much. So caffeine might not be that bad, when it comes to what I just spoke about. So
Just a little plug. What's your favorite flavor, guys, of Celsius?
Comment below.
Yeah, comment below. What's your favorite?
one?
Ours is 100% peach mango green tea.
Love it. God, it's so good.
My second runner-up is probably... I think there's one like mango.
There's like a mango guava maybe.
Maybe, yeah, I think it's mango guava.
But that one's sparkling.
Oh, yeah, maybe.
I tried it recently. I'm like, this is not bad.
It's delicious.
This one's still my primary one. I mean, I have it already on Amazon, like just on subscription.
It's so good.
It is
so good.
It just doesn't take that sugary energy drink.
It's perfect.
It is.
All right. So next one, dementia is more common in people with essential tremor. So this is by Judy George, published on MedPage today on March 6, 2024.
I love a name with 2 first names.
Judy George. All right. So this article reports a study presented at the American Academy of Neurology annual meeting, which found that dementia is more prevalent in people with essential tremor compared to the general population. So over a 5-year period, the cumulative prevalent... All right. Over a 5-year period, a cumulative prevalence of dementia in individuals with essential tremor was 18.5. On the average annual conversion rate from mild cognitive impairment to dementia was 12.2%. So these rates are significantly higher than those in the general public, but lower than those reported in Parkinson's disease. So in the study, it involved 222 patients with essential tremor. Okay, so essential tremor is basically a neurological disorder that causes you just, I'm trying to just be the most simple
layman.
Yeah, it's just you have tremors. Okay, so but these tremors can be pretty significant. Like it affects your day-to-day life. You cannot write, you cannot pick things up, you can't eat properly because of how much you are having these tremors. Okay. So in this study of 222 patients with essential tremor with a mean age of about 79 years, and it highlighted the importance of informing patients and their families about the increased risk of dementia associated with essential tremor, which just scares the shit out of me because I'm pretty sure I have an essential tremor. All right. Okay. Great.
Well, you need to get that addressed.
I mean, I don't have it that bad, but you see it. This is the weekly podcast, but I have a tremor. I do.
Well,
I have a tremor.
It's good to bring light to it. So if other people have it, they know what to do. There are new treatments for it. But it's more on your dominant.
On my right, on my dominant hand. Isn't that crazy?
Yeah.
All right.
Well, you gotta see.
Not that,
you gotta see
my
the
grandmother had
doctor.
Alzheimer's.
We're gonna do an episode on essential tremor anyways, and we'll talk more about it. But it's something that there's
actually a lot of cool things coming out with that.
Very, very cool things. And we'll talk about it more in depth when we go to that episode, because we have somebody in our family that, underwent one of the newer treatments for it, and it's fantastic. So
super cool.
We'll really go more into depth about it because a lot of people have it and they don't even know.
Yeah.
And they're not even diagnosed with it. They're just like, sometimes people are scared because they're like, I don't want to go to the doctor because I think it's Parkinson's. And it might not be.
And it might not be.
You know, so there's a lot to it, but we'll go
In
into
my family,
that.
we call it a tembleque.
For Cubans, yeah.
A tembleque.
Yeah.
You know? You have a little bit of tembleque.
Yeah. Anyway, all right. So CBD risk tied. CBD, by the way, is cardiovascular disease. Risk tied to teeny tiny plastics lodged in atherosclerotic plaque by Nicole Liu, published on MedPage Today on March 6, 2024. The article discusses a study that found microplastics and nanoplastics lodged in arteriosclerotic plaque, which could foreshadow future cardiovascular disease. I hate that this is happening, but I love that all these studies are coming out, because for those of you that haven't seen past episodes, I did extensive studying on microplastics and how, you know, in the oceans, like from the oceans to our plates, like, or more. You know, it could even be as a vector for diseases and et cetera, et cetera, et cetera. Like, I did extensive research on that. So seeing that there's a lot more light being shed into nanoplastics, microplastics and whatnot I love it, because it really, really needs to be, it's a problem. It's getting into our food. It's getting into us. It's horrific. But anyway, so the article observed an increased risk of myocardial infarction, stroke, or death in patients with these plastics in their plaques. Polyethylene and polyvinyl chloride, these are types of plastics, because if you guys didn't know, there's many types of plastics. That's why some plastics look like they're like for a milk gallon, you know how they're like a little dark, or they're frosted or something. That's one sort of plastic. And then water bottles are clear. That's because it's a different type of plastic. So that's what I'm saying here. The prevalence of these plastics is increasing, and they may enter the human body by various means, including drinking water, food, cosmetics for us makeup loving people, and even the frickin' air, because they're that tiny these days. So the study highlights the need for further research on the health effects of microplastics and nanoplastics. So a really, really good read. Of course, as I've always said, all of these, you know, we only do summaries, but I will list them all in the show notes. So if you want to read more on these particular ones that we're summarizing, go ahead to the show notes. It's there. But very, very scary stuff, these nanoplastics.
Microplastics, nanoplastics scare the shit out of me.
Yeah, you don't taste them. It's not like, oh yeah, I'm gonna know.
Every single time I microwave some plastic, I'm just like, what am I doing to myself? What am I doing? I'm just asking for death.
Switch over to the glass.
I do. I usually have glass containers, but there's like,
I switched it all over. Like, I've never, ever since I did the studies, like,
you never. Yeah. Okay. Well, I just need to do it. I mean, I have, like, all my stuff is glass, but there are certain things.
It's either stainless steel or glass.
Yeah, the Stanley.
What is Stanley?
You said that Stanley had, like, the whole.
But it's the lead inside, like, underneath.
Yeah.
Like, okay, so it's covered all by stainless steel, inside and out.
Yeah.
So then there's, like, a tiny little lead knob in the bottom. It helps keep it cool. And then the two, like, nails. Yeah. I saw the MRI of it. Yeah. Because I'm a nerd. So I saw the MRI of it. And I'm just like, guys, for you to reach that lead, you had to, like, it must penetrate the whole stainless steel interior.
Yeah.
Stanley, I am making a case for you. I'm with you. So if you want to sponsor us, hi. Yeah, so you're fine, guys, unless you damaged the shit out of it. Okay, fine.
Yeah.
You can't drink from it anymore. But, like, if it's just, I mean, you're fine. You're fine. It's better than plastic. That's what I guess. My team, it's better than plastic.
Oh, no, for sure. 100%.
Plastics you will end up drinking it sooner or later. It's horrible. Look.
Okay.
Stainless steel.
No.
I'm telling you. The more you look at my stuff, the more you be like, she hates plastic. I know.
I'm kind of just, like, looking at things.
Now you're looking at everything. You're like, there's as little plastic as possible.
Seriously. All right. Semaglutide. Reduced inflammatory biomarkers in HIV patients with lipohypertrophy. Okay.
It's crazy how much is coming out. Like,
with semaglutide, it's crazy. Yeah, I know. Of course, more people are using it. More things are being observed.
Yep.
Okay. So this is by Tara Hale, published on MedPage Today on March 6, 2024. So this article discusses a study presented at the Conference of Retroviruses and Opportunistic Infections. The study found that semaglutide a GLP-1 receptor agonist, reduced levels of inflammatory biomarkers in HIV patients' lipohypertrophy. Okay. So after 32 weeks, patients receiving semaglutide experienced significant decrease in interleukin-6, high sensitivity CRP, C-reactive protein, and soluble CD163 levels, while placebo group saw non-significant changes. Okay.
All good things for the liver.
Yes, exactly. These results suggest that semaglutide could be an effective treatment for lipohypertrophy in HIV patients, which is associated with increased cardiometabolic risk due to chronic inflammation.
So correct me if I'm wrong, but lipohypertrophy is like a lot, like fat, like liver fat, right?
Yeah.
Okay. Okay. So that's what it is for those of you that didn't know, but yeah.
Yes, ma'am.
So it reduces liver fat, which is one of the first stages of
and then leads to inflammation. And
liver
all that.
problems and whatnot. It's not liver cirrhosis, at least not yet, but it's kind of like
cirrhosis
the
is more
gateway
like
to it.
scarring.
Exactly. But it's a problem. It's a liver problem. Anyways, New York cheese producer pleads guilty to causing listeria outbreak that killed 2 and hospitalized 8. By John
Hayworth.
On March 6, 2024. Published on ABC News. Sorry, I'm not making fun of your name. I'm making fun of myself. It's me, not you. Don't they all say that? The article reports that Johannes Bolto and his company, Bolto Creamery LLC, have pleaded guilty to a misdemeanor count of introducing adulterated food.
I was gonna say I'm like altered, maybe. Adulterated?
What the fuck was I thinking when I wrote this?
I don't know.
Adulterated food. Adulterated cheese. X-rated cheese. What the fuck does X-rated cheese even look like? I
don't even know. What?
Yeah.
I have no idea. What are we talking about?
I'm trying to think of like, why would I put adulterated food?
I don't know.
Anyway,
I think you just meant altered.
Obviously, that's what I meant. Okay. Altered food into interstate commerce. This plea is in connection with a listeria outbreak from 2016 to 2017 linked to cheese made at their facility, which resulted in 2 deaths and 8 hospitalizations. Environmental swabs at the creamery had repeatedly tested positive for listeria species. Like, come on. Following the FDA's linkage of the outbreak to Volto Creamery's cheese, the facility was shut down and a full recall was issued. The case highlights the severe consequences of foodborne illnesses and the importance of food safety practices. Yeah, not good, Volto. Not good.
Not good. All right. Landmark study links microplastics to serious health problems by Max Kozlov on March 6, 2024, published on Nature. Let's talk about more about microplastics. We're going to drill it in. All right. So the article from Nature discusses a landmark study that found a correlation between microplastics in the bloodstream and increased health risks. So the study involved 200 individuals undergoing surgery, nearly 60% whom had microplastics or nanoplastics in a major artery. So 60% of people, 60%, okay? Those with plastics in their arteries were 4.5 times more likely to suffer heart attack, stroke, or death in following 34 months compared to those without. So, however, the study does not conclusively prove that microplastics cause these health issues, as other unmeasured factors like socioeconomic status might also contribute. But let me just say something.
Plastics should not be in your blood.
Yeah, plastic should not be in your blood, first of all, okay? Nor in your urine or anything. But, okay.
In your body.
This last statement here, factors like socioeconomic. I grew up fine, okay?
Yeah, but we weren't rich.
Yeah, we weren't rich,
like that.
okay?
Like, let's
There was a lot.
I'm
just going to say there was a lot of plastic in my life.
Yeah, there was a lot of coupon cutting, you know.
Yeah.
All those things. Yeah.
You know, when they say things like this, like socioeconomic, I'm like, well, you know, sometimes that's all they have.
Exactly.
You know?
Exactly.
So there is definitely a link there.
I know.
But anyways.
People have to, you know, PC themselves and whatnot, so whatever.
Yeah.
Anyway, so, all right. Vampire facials.
Oh, gross.
Yeah, it is. No.
So, okay, so vampire facials. So they basically draw your blood, they centrifuge it, and then they put like all that goody stuff back into your face by like microneedling.
It's not supposed to happen, guys. That's just not. They're not supposed to take out your blood to then. This is it. Like it's not supposed to happen. I'm up for facials. Yeah, clean your pores or whatever. That's fine. But like, why must we take out your blood to then put it back?
Yeah, weird.
There's a lot going on there that shouldn't be happening. Anyway, so vampire facials at spa linked to HIV infections.
Can't believe that.
I honestly, but I can't be shocked. I can't be shocked. You're taking out blood in a freaking spa, okay? You're not in a hospital. You're not in a doctor's office. You're in a freaking spa, okay? Yeah. And then they're putting it back into you.
I just think that, okay, so like you can take out blood from anywhere, right? Like,
yeah, but these are not people trained for that.
That's what I'm saying. That is the difference. Or anything like that is the difference, because I can put a phlebotomist in Hawaii and I can put a phelobotomist here in Miami.
Fine, yeah.
And I can put them in a bathroom, okay?
Fine.
But they're gonna be like, I can't do it here.
Right.
You know? So this is what I'm saying. It's I think they're in these places where it's usually meant things that are like more aesthetic procedures, maybe not as harmful or something like that. But they take this tiny little thing, right?
Yeah.
And then all of a sudden it becomes a crazy problem.
This is a big problem.
It's a huge problem.
Like, I mean...
Oh my God, if someone fucking told me that I had HIV from my fucking vampire facial. Yeah. Oh man.
I'd be so pissed. I'd reach the Kepler belt.
Yeah.
Of rage.
Yeah.
Anyway, so by Catherine Kahn, published on MedPage Today on March 7, 2024. So the article reports on 5 cases of five too many, HIV infections linked to a spa in New Mexico that offered vampire facials, a cosmetic procedure involving platelet-rich plasma microneedling. The CDC found that these cases were likely due to unsanitary conditions at the spa, including improper disposal of needles and storage of biologics.
I don't understand improper disposal of needles.
They were
what is like, you take a needle, you make sure they literally teach you in every place as like a medical person how to handle it, okay?
Exactly,
and dispose of it. There's literal boxes specifically.
That's exactly the problem. These are not people, not phlebotomists or trained individuals for this. So they're just discarding it, or they're just handling it however they think is clean enough, or however they think is safe enough.
Or are they reusing?
Probably. Or they're probably, they have to be reusing something there in order for it to have caused this. Something there was tainted or has been retouched. Well,
there's definitely something there that they did not do correctly.
No, for sure. It has to be, because if not, this wouldn't be happening.
Yeah. Where's OSHA?
Okay. Exactly. This is the first known instance of HIV transmission through cosmetic injection services in a non-hospital setting in the U.S. The investigation, which began in 2018 after a spa client was diagnosed with HIV, is still ongoing. Health officials emphasize the importance of regulatory oversight in such clinics and the potential risk of blood-based transmission of HIV in non-hospital settings. Guys, please be careful with what you do in these med spas or whatever. You know, just because it says med spa doesn't mean that you could just fully trust it, like closed-eyed. Do your research before you go and have any of these procedures done to you. You could get something that's very, very harmful and dangerous to you. You know, just be careful.
All right.
That's my stance on that.
Yeah. Benzene can form in acne treatments, lab finds. Okay, this is by Jennifer Henderson, published on MedPage Today on March 7, 2024. So the article reveals that benzoyl peroxide acne treatments can degrade into benzene, a known human carcinogen. Great. Fabulous. This discovery was made by Valizour, okay, an independent laboratory, which found that 94 out of 99 benzoyl peroxide products tested contain benzene, often exceeding the FDA's limits of 2 parts per million. Okay.
Great.
So the lab conducted stability studies at various temperatures and found that significant amounts of benzene could form over time, even at body temperature. So this raises concerns about safety of acne treatments throughout their life cycle. That's insane. I use benzoyl peroxide all the time.
There you go.
All right, I guess I'm not going to use that anymore.
Go back to salicylic acid or adapalene.
Adapalene.
There.
Adapalene.
I made it a name.
Yeah, I know. I love it.
Sounded like Adeline there, which is a great movie. The Age of Adeline. Wow, tangent. So, experimental weight loss pill seems to be more potent than Ozempic. I'm telling you, this is just a trend that's not gonna stop.
Yeah, it's not gonna stop.
We opened that box, and now we just can't stop. By Claire Wilson on March 7, 2024, published on The New Scientist. So the article discusses an experimental weight loss pill called amycretin. Right? Right.
Yeah.
Which appears to be more effective than existing treatments like Ozempic and Wegovy. In a trial, amycretin led to 13% weight loss over 3 months, which is more than twice the amount seen with Ozempic and Wegovy. The pill mimics the gut hormone GLP-1 and another hormone called amylin, contributing to its potency. However, larger and longer studies are needed to confirm these results and determine the long-term effectiveness and safety of amycretin. So we'll keep an eye out for that because this is pretty big.
All right.
Oh,
Back to LSD.
yeah.
All right.
If you guys are Patreons, you
Yes.
know why we're saying that.
All right. So a single dose of LSD provides immediate and lasting relief from anxiety, studies say. Okay. By Sandy Lamotte, published on CNN Health on March 7, 2024. So the article reports that the U.S. Food and Drug Administration, the FDA, has granted breakthrough therapy status on LSD formulations, MM120, for treating generalized anxiety disorder. The designation follows a clinical trial following a typical... Sorry, I can't read today. All right, so the designation follows a clinical trial showing that a single dose of MM120 provides immediate and lasting relief from anxiety. So, with a 48% remission rate in at least 12 weeks post-administration. That's crazy. That
Yeah.
means half of the people.
Yeah.
Half.
Yeah.
That's a lot.
Yeah.
So the trial also indicated that 65% of wow. Okay, all the dogs.
Oh my god, guys! Let's have more patrons so we can have our own pod lab.
Yeah, I know.
Okay, thanks.
Okay.
And like that, we don't have this problem.
Subscribe. Okay.
Subscribe, please. Pod lab,
Yeah. That was Newman saying pod lab.
right?
Yeah. All right. So the trial also indicated a 65% of clinical response rate within 3 months. So not even that, what was it? 12 weeks. Yeah.
Yeah.
So that's 3 months. No, 4 months. 4 months. So 65% of that clinical response happened within 3 months. Okay. So the breakthrough status will expedite the development of processing or expediting the process of. All right. I quit. Okay. The breakthrough status will expedite the development process of MM120, which is still subject to standard FDA approval procedures, including phase 3 trials. This is insane.
It's crazy.
Oh my God, I can't wait to see what everyone is saying about this.
How
But you
far
know what?
LSD has come?
You know what? People that have refractory, generalized anxiety disorder,
yeah.
like,
Yeah.
I'm sure they're willing to
Anything.
Yeah.
Anything to help.
to feel normal.
Absolutely.
Yeah.
Absolutely. And of course,
And this is not, just like take a little blotter. What is it? Blotter paper.
whatever.
Whatever it
Go
is.
back to our Patreon episode. Yeah. And it's insane that and that's why I kind of tied it. That's kind
Yeah.
of why I did it, because we just talked about MK Ultra and how LSD was used and the craziness that happened with LSD
Yeah.
and how bad it turned out for a lot of things in MK Ultra using LSD. And
Yeah.
then now it's come this far that scientists have been able to formulate it in a way that it could be helpful.
Yep.
It's crazy. Amazing. Crazy and amazing. Anyway, so back to Ozempic. Ozempic and similar weight loss drugs can increase risk of complications during surgery, because I just had to include this because everything we have been talking about lately about GLP-1 type of drugs or whatever, agonists, have always been like positive. But there is, of course, like in everything, there has to be some negative. So by Tony Hicks on March 7, 2024, published on Medical News Today. The article highlights a study that found weight loss drugs like Ozempic, which are GLP-1 receptor agonists, can increase the risk of complications during surgery. These drugs slow down stomach emptying, which can lead to a buildup of gastric contents and raise the risk of aspiration during surgery. As a result, patients taking these medications may need to fast for a longer period before undergoing anesthesia to reduce this risk, which I have seen, at least in my family, that they have been on these drugs or whatever, and they have to go to a surgery. They have to like stop the GLP-1 for like, they can't take the last dose.
Yeah.
You know, to like help avoid this risk. So
yeah, I mean, there's a lot of studies, right? You know, there's good things coming out from
100%.
GLP-1 agonists.
Yeah.
And then there's bad stuff, right? So
like
one of
everything.
the bad things is the delayed gastric emptying. And that can cause just a lot of problems in general. I mean, there's people that are hospitalized because they cannot eat. They cannot eat.
It affects everybody differently, right?
Yeah.
So that's why you have to take it in, and it always goes in doses. So if you get on one of these GLP-1 agonists, you'll start in a very low dose and increase as your doctor sees fit. There are some people that could only go up to a certain level. There's some people that need to go all the way, you know, because they could tolerate it, whatever. And these are one of the risks and why it's done like that, you know?
Yeah.
Go ahead.
All right. So the evidence connecting migraine and mental health.
I am the exhibit A of this.
All right, so this is by Morgan Meisner, PhD. So Dr. Morgan Meisner, updated on March 7, 2024, published on Medical News Today. So the relationship between migraines and mental health is a complex one, with research indicating that those that experience migraines are more likely to face mental health challenges. So studies show that migraine sufferers report mental health issues at more than double the rate of individuals without migraines.
You don't say.
The conditions most commonly associated with migraines include anxiety and depression, with migraineurs being 5 times more prone to depression and 25 times more prone to daily anxiety. Okay. So additionally, there's a significant overlap between migraines and other psychiatric conditions such as bipolar disorder and PTSD.
Thankfully, no.
And let me just say, just because you have migraines does not mean that you have this. And again, just there are people that have PTSD and probably have never had a migraine before. Who
Exactly.
knows?
Very complex.
However, the two are kind of linked. How can I say? I always explain it in the way of like, when you have a migraine, what do? You go to sleep and you get better, right?
Yeah.
Why? Because like lower stimulant environment, you're resting, you're relaxing, turn off the lights.
Which right now I'm focused by all these lights.
Just like this, like crazy. Like
just
right
do
now.
everything that I'm not doing right now.
Yeah.
That's how you help a migraine.
Yeah. So anyway, so the connection is not one way. Mental health issues can exacerbate migraine symptoms, and the migraines can lead to mental health problems. So a lot of pain, long-term pain can lead to anxiety, depression, and other things.
And thankfully, I'm not one of those people that I know these people personally that they suffer from migraines chronically. It's very, me, it's maybe once a month, maybe once every couple of months or whatever that I have like the 3-day horrible migraine like I'm experiencing right now. And this is like probably like day 3. Yeah. First day, shut off the lights, shut off everything. I am cocooning myself like I cannot exist, you know? But there are some people that go through that chronically, like maybe on a weekly or basis. They have to take medications for it, like Topamax or whatever, and all that stuff.
They have to take preventatives and avoidance.
That's a whole different level, and of course that's going to affect your mental health. How is that not? You're chronically in pain. That's like any other type of chronic pain that you're dealing with on a daily basis. And I'm telling you, migraines are something like you just move and it hurts. Anything you do.
Anyone that has experienced a migraine knows.
Exactly.
When you know, you know.
When you know, you know. Continue. I'm sorry.
All right. So effective management of migraines often requires a dual approach that addresses both physical and psychological aspects, with stress management playing a key role in prevention and mitigation of the migraine episodes. This holistic understanding is crucial for improving the quality of life for those affected by both migraines and mental health issues. And just because I say holistic doesn't mean that like we're over here like trying to throw a pill at you if we have migraines. Trust me, I am the first person to be like, how much are you sleeping? How much are you hydrating? What exacerbates it? You know? So just do all the things that you need to do, because we can throw a million medications at you, but you will continue to have migraines if you do not fix the underlying triggers.
100%. 100%. Back to Ozempic.
Okay.
It's always on the news. It's everywhere. Like, I mean, there's a lot of things happening with it. So, and this is one of them. Another one. Ozempic may delay kidney disease progression in latest trial results show. by Catherine Lang on March 8th, 2024, published on Medical News Today. The article discusses findings from the FLOW trial by Novo Nordisk. That's where Ozempic comes from this company, which suggests that the diabetes drug Ozempic, aka semaglutide, could significantly delay the progression of chronic kidney disease, so CKD, in patients with type 2 diabetes. Huge. Amazing. The trial showed a 24% reduction in the risk of kidney disease progression compared to a placebo. That's pretty large, okay? When you're doing scientific studies, 24% is pretty big. You know,
Yeah.
Because typically you have like a 5% maybe or something like that, which is, oh my God, what the hell is that called again?
Oh.
I don't remember. But anyway, so 24% is pretty significant. Semaglutide is part of a class of drugs known as, well, we have said a million times, GLP-1 receptor agonists, which not only help control blood glucose, but also reduce the risk of heart attack, stroke, or death in adults with type 2 diabetes and heart disease. The detailed results of the FLOW trial are expected to be presented at a scientific conference later this year, so stay tuned for that. But another benefit.
All right. So cheese. No, not the cheese. Okay. Cheese recalled in 15 states over listeria concerns.
If you follow us on TikTok, I did a small little TikTok video
a little tidbit
on that. So follow us there.
All right. So this is by Kim Bellware on March 8th, 2024, published on Washington Post. So Sargento, a Wisconsin-based cheese company, has voluntarily recalled some of its products to potential listeria contamination. Oh my God, I need to look at what I have from Sargento.
I thought you knew about this.
No, I did.
Okay.
And I'm pretty sure I like cleared everything, but it's just like,
I know.
I kind of almost forgot a little bit of it. Okay.
No, Sargento's huge.
Yeah, exactly. So the recall was announced on March 8th, 2024, and affects products supplied by Rizzo Lopez Foods, Inc., Incorporated. All right. A California-based manufacturer linked to ongoing listeria outbreaks. Ongoing. Why are they still open? Why? Okay. The recalled items were sold to food services groups and not directly to consumers. Sargento has terminated its relationship with Rizzo Lopez Foods and has notified its customers. Okay, so it's not actually Sargento. Okay, it's that distributor that distributes it out. Okay,
yeah.
That wholesaler or whatever.
Yeah. All right. So this one, I also did a tidbit on this one. So please check on this. This is really important as well. Lead-tainted cinnamon has been recalled. Here is what you should know. By Jonelle Alicia on March 8th, 2024, published by AP News. The article reports on a recall of ground cinnamon due to lead contamination. The FDA issued a safety alert for 6 brands of cinnamon, including those sold at Dollar Tree and Family Dollar stores. This action follows previous recalls of cinnamon applesauce pouches like Buena Banana, linked to nearly 500 reports of lead poisoning in children across 44 states. We did cover this in a previous recap and as well in TikTok, so check that out. Anyway, the FDA found lead levels in cinnamon ranging from 2 to 4 parts per million, significantly lower than the levels found in contaminated applesauce pouches. There is currently no FDA limit for heavy metals and spices, which is bonkers.
Crazy.
But again, one of the many reasons why we're being poisoned. But there is a limit of 1 part per million of lead in candy, likely to be consumed by small children. The recalls have raised concerns about the safety of cinnamon, a common spice in American households. So guys, check that out.
Yeah. All right. So Florida man complains of migraines. Doctors find tapeworm in his brain from eating undercooked bacon.
Yeah.
Awesome. Florida. Great.
Here we go.
All right. By Alex Mitchell, published on March 8th, 2024 on the New York Post. So a recent study reveals a startling medical situation where a 52-year-old Florida man suffered from a tapeworm infestation in his brain, which was traced back to his consumption of undercooked bacon. Initially presenting with severe migraines that persisted for a week, further medical investigation revealed the presence of neurocysticercosis, a condition where a tapeworm larvae infects the brain. This unusual case underscores the importance of thoroughly cooking pork. Okay, so that's the main thing that I want to say. It's not just bacon, it's just pork in general. So neurocysticercosis is very linked to that.
To pork, undercooked
to pork, exactly, undercooked pork. So pork products and maintaining proper hygiene to prevent such parasitic infections. So if you're cooking or if you have raw pork somewhere and you go and you cut a salad or something, and you're eating all of that, okay? So just separate it for the love of God. Okay. So the man's treatment with the deworming drug albendazole led to significant improvements, emphasizing the effectiveness of prompt medical intervention. All right. So another 3 common pesticides are now linked to Parkinson's risk.
Yeah. Be careful with what you eat, folks. Again.
Seriously. By Hannah Flynn on March 9, 2024, published on Medical News Today. So recent research presented at the American Academy of Neurology's 76th annual meeting has established a strong link between 3 commonly used pesticides and an increased risk of Parkinson's disease. The study, which analyzed data from over 21 million Medicare beneficiaries in the United States, found that exposure to 14 different pesticides was associated with a higher risk of developing Parkinson's. The study, which analyzed data from over 21 million Medicare beneficiaries in the United States, found that exposure to 14 different pesticides was associated with a higher risk of developing Parkinson's, particularly in the Rocky Mountain and Great Plains regions. So among these, simazine, lindane, and atrazine were identified as having the strongest relationship with the disease.
Yeah, so be careful with what you eat, guys.
Yes.
Once again, I know it's hard, but try to eat organic and stuff like that. They do less with pesticides and monitor those things. I know it's more expensive and harder to reach, but if you can, try to do the switches on things that you can, because more and more things are coming out on like the stuff that we eat.
Yeah.
So the new science on what ultra-processed food does to your brain by Andrea Peterson on March 11, 2024, published on the Wall Street Journal. The article discusses the impact of ultra-processed foods on brain health. It refers to a study that found consuming a diet high in ultra-processed. Guys, there's not a crazy person in my here. It's just
MR.
It's my child. We're in spring break and we're trying to still produce this. So, wish me luck. Anyway, so the article discusses the impact of ultra-processed foods on brain health. It refers to a study that found consuming a diet high in ultra-processed foods can lead to a faster rate of cognitive decline. Specifically, individuals who get more than 20% of their daily calories. I went southern there for whatever reason. 20% of their daily calories from ultra-processed foods may experience a 28% faster decline in global cognitive function and a 25% faster decline in executive function. The study, which involved over 10,000 Brazilian participants, suggests that the high consumption of ultra-processed foods in Western diets could pose a significant risk for cognitive health as people age. This is like the theme of today's recap has been be careful with what you eat.
Yeah, seriously.
It's crazy. But this is like the most
processed foods,
nanoplastics, chemicals in your food for Parkinson's and other neurodegenerative diseases. It's crazy. It's crazy.
All right,
Talking
Alzheimer's.
about neurodegenerative diseases.
Alzheimer's. There's a theme today to today's recap.
It is.
Okay.
And I didn't do it on purpose, guys. This is literally just...
It's what's happening. It's what's coming out.
Yeah.
Alzheimer's may be caused by a buildup of fat in the brain cells. By Claire Wilson, March 13, 2024, published on New Scientist. All right. So a recent study suggests that a novel perspective on the cause on Alzheimer's disease, implicating the accumulation of fat droplets in brain cells as a potential root cause. This theory diverges from the traditional focus on the protein buildup, such as the beta amyloid plaques and tau tangles, which have been the primary suspects since I can remember.
Yeah.
Okay?
Yeah.
So the research led by Michael Haney at the University of Pennsylvania highlights the role of APOE gene, particularly its APOE4 variant, in promoting fat droplet accumulation in the brain immune cells. So this discovery opens up new possibilities for treatment strategies targeting these fat droplets, potentially offering more effective solutions than current protein targeting drugs.
So just another way of potentially treating Alzheimer's, which is great.
Yeah, exactly. Anything. We'll take anything.
Okay, so toxic asbestos is now fully banned, a move that EPA calls historic. By Anna Phillips on March 18, 2024, published in the Washington Post. Why is asbestos still around? Has been around, I don't know. We can't even build with it.
A lot of people have it, from old homes and stuff like that.
And then they have them removed. It's illegal to build with it now for obvious freaking reasons. So anyway, so the U.S. Environmental Protection Agency, the EPA, has announced a comprehensive ban on crystalline Asbestos? Asbestos.
Chrysotile.
That. Asbestos. The last form of asbestos legally used in the country. Thank the Lord. This decision, effective from March 18, 2024, is a significant expansion of EPA regulation under the 2016 law that revamped rules for toxic chemicals. This type of asbestos was still found in products like brake linings, gaskets, and certain materials used in water purification. It goes against...
Yeah. Water purification.
Okay.
We'll leave it there.
Yeah, we'll just... Okay. The ban aims to protect public health from the well-documented cancer risks associated with asbestos exposure, which is linked to over 40,000 deaths in the U.S. annually. The move aligns with President Biden's cancer moonshot initiative and marks a historic step in chemical safety over 30 years in the making. It boggles the mind. It's like, oh yeah, we're going to filter your water, but add some asbestos to it.
Seriously.
What?
Who knows?
Anyway, go ahead.
All right. Here's the big one. Scientists say they can cut HIV out of cells, by Michelle Roberts, March 19, 2024, published on BBC.
Check out our recent CRISPR episode. We
exactly.
literally just did this
I know, we just did it.
Just now.
I know.
Incredible.
So scientists at the University of Amsterdam have made a groundbreaking advancement using CRISPR gene editing technology to eliminate HIV from infected cells. This molecular level technique acts like scissors, selectively cutting out bad portions of the DNA. Although the research is still in the early stages and is considered a proof of concept, it holds the promise that one day being able to completely remove HIV from the body. This is crazy.
We talked about it in our CRISPR episode.
Yes.
The technology that's coming out from it is just
crazy. It's insane.
It could revolutionize healthcare. It really can.
Yeah. However, experts caution that much more research is needed to ensure the safety and effectiveness of this potential therapy. Current HIV treatment can suppress the virus but cannot eradicate it, and the CRISPR method could offer more definitive solutions in the future. And this is just opening doors. Like, okay, all right, HIV perfect. Okay, but what about hepatitis? Like, what about, I don't know, just so many things.
All these other viruses. Yeah. And we're always having to
just everything.
Yeah, and we're always having to like be careful of these viruses. COVID-19 showed us exactly that.
Yeah.
So how can this, I mean, you could go on a very far, deep tangent with how much this could help out.
All right. Good. 61 unexpected forever chemicals found in food packaging, by Catherine Borzak on March 19, 2024, published on Scientific American.
Clearly a theme.
Yeah. A recent global study highlights a Scientific American article has discovered 61 perfluoral. Okay, wait a minute. Okay.
Kilo. Yeah.
Perfluoroalkyl.
Yeah.
Alkyl.
Yeah.
Polyfluoroalkyl.
PFAs.
All right, yeah. So, okay.
That's what I would call them.
A recent global study highlighted a Scientific American article has discovered 61 PFAs. Okay, so PFA stands for perfluoroalkyl and polyfluoroalkyl substances. Okay, so these are commonly known as forever chemicals in various food packaging materials. These chemicals, which are not authorized for use in food containers, have raised concern due to their potential health risks and persistence in the environment.
Plastics.
Yep. So PFAs are used for their water and their grease repellent properties and can be found in products ranging from cookware to cosmetics. However, they are resistant to degradation, leading to their accumulation in the human body and the environment. The study's findings underscore the mismatch between the detected chemicals in food packaging and the database of chemicals authorized by regulatory agencies, indicating a significant knowledge gap regarding the presence of PFAs in everyday products. The researchers were only able to assess potential hazards for 57 of the identified PFAs, highlighting the need for more comprehensive understanding and regulations of these substances in consumer goods.
Yeah. So it's like the saran wrap type of coverings that you see in foods in the grocery stores. That's what we're talking about, which of course there's a picture of it posted here if you guys are watching. If not, well, there was in the beginning once she started talking. If you watch this on YouTube, then I'm always putting a little snippet of the article that I pulled. It's right in the center of us so you can see what we're talking about. So anyway, So yeah, first weight loss drug gets approval for heart disease. Here's what we would know. We're going back to the Ozempics. So by Sarah Reardon on March 19, 2024, published on Scientific American, Wegovy, semaglutide. A weight loss drug known generically as semaglutide has been approved by the U.S. FDA for reducing the risk of serious heart conditions in certain high-risk individuals. This marks the first time a weight loss medication has been authorized for heart disease prevention. The approval is specifically for adults who are overweight or obese and have experienced at least one cardiovascular event such as heart attack or stroke. The decision was based on the SELECT trial, which showed that participants taking Wegovy lost an average of nearly 10% of their body weight and had a 20% lower risk of heart attacks and strokes over 3 years, in addition to improvements in cholesterol and blood pressure levels. The drug should be used alongside a reduced calorie diet and increased physical activity. However, Wegovy is not without risks. It carries warnings for thyroid C cell tumors, pancreatitis, gallbladder problems, low blood sugar, acute kidney injury, hypersensitivity reactions, diabetic retinopathy, increased heart rate, and suicidal behavior or thinking. But pretty good stuff is coming out of it.
All right. So study finds 129,000 Chicago children under 6 have been exposed to lead contaminated water. So this is by Charlie DeMar, Adam Harrington, updated on March 19, 2024, published on CBS News. A study published in JAMA Pediatrics has revealed that nearly 70% of children under 6 in Chicago have been exposed to lead contaminated water. The research, which utilized artificial intelligence to analyze over 38,000 home water tests, found that children in homes using unfiltered tap water had approximately double the amount of lead in their blood compared to those who did not. The study also highlighted racial disparities, with Black and Latino residents being more likely to have lead-contaminated water due to lead pipes. This exposure poses significant health risks, as lead is a potent neurotoxin that can affect the childhood brain development and contribute to the various diseases. Despite the known dangers, Chicago still has around 400,000 homes with lead service lines, the most of any U.S. city.
That's crazy.
Yeah. The findings underscore the urgent need for widespread testing and remediation to protect the children from harmful effects of drinking water.
Lead's no joke.
Yeah.
And the fact that
it's like the new Flint, Michigan.
Yeah, it's crazy. All right. So this one was a very recent one that I added here, but I had to. Can you buy your way into residency?
I think so.
By Christina Fiore, published on MedPage Today on March 20, 2024. The article discusses a controversial issue of buying residency positions in the medical field. It highlights instances where individuals claimed that they were offered residency slots for substantial sums of money, ranging from $150,000 to $200,000. The article refers to a specific case where Varun Chopra, MD, after years of unsuccessful applications to residency programs, was allegedly offered a residency position through a $400,000 donation. It's just this, yeah, by his parents to a medical center in Michigan. This arrangement led to a legal battle when Chopra was dismissed from the residency and his parents sued for a refund, ultimately winning the case. The article also mentions a separate incident involving Alexander Everest, who was accused of running a residency scam and attempting to bribe a hospital employee to secure residency slots for payments of at least $100,000 each. These cases shed light on the dark side of medical residency placements and raise questions about the integrity of the process, which, in my humble opinion, is a process. A very questionable process, but yeah.
I wouldn't be surprised.
Yeah.
All right. First ever pig kidney transplant performed in living recipient. Mm-hmm. So this is by Kristen Monaco, published on MedPage Today, March 21st, 2024. The article reports on a groundbreaking medical procedure where a 62-year-old man with end-stage kidney disease received the world's first successful transplant of a genetically edited pig kidney.
More on CRISPR.
Yeah. The surgery was performed at Massachusetts General Hospital, MassGen, and the patient, Richard Rick Slayman, is recovering well. The pig kidney underwent 69 genomic edits to enhance compatibility to reduce the infection risk. This medical breakthrough, performed under the FDA's compassionate use protocol, offers hope for the thousands waiting for a transplant and represents a significant advancement in xenotransplantation. So xeno means between species to species. So this, in this case, from animal to human.
Amazing. Amazing.
Crazy. Amazing.
And one of the last ones here, over 3 billion people now live with neurological conditions. And what does this mean? By Erica Watts on March 21st, 2024, published on Medical News Today. A recent study published in The Lancet Neurology reveals a staggering statistic. Over 3 billion people worldwide are living with a neurological condition. This includes diseases such as dementia, stroke, and Alzheimer's. These conditions have now become the leading cause of disability and illness globally. The study, which analyzed data from 2021, found an 18% increase in disability-adjusted life years caused by neurological conditions since 1990. The majority of these cases are in low and middle income countries, where access to neurological care is significantly less than in high income countries. The report calls for urgent action to improve care and support for individuals with neurological conditions to ensure better brain health across all stages of life. So yeah.
All right, guys.
And that was this last month's recap.
Yeah.
There was a lot. There was a theme. There's, just be careful with what you eat.
The theme was be careful what you eat.
Yeah.
There's a lot of things showing that what we eat may potentially put us at risk for neurodevelopmental, neurodegenerative diseases. Yeah. CRISPR is on the cusp of all things medical breakthroughs.
So is GLP-1s.
Yes, GLP-1s is also showing us a huge wave. I don't know. It's
just a lot going on. Yeah, a lot of good ongoing stuff. So yeah, thank you guys for tuning in. Check out our Patreon, patreon.com/Funny Medicine Podcast. Thank you guys that are patrons there. You keep us going. And if you guys have any suggestions, requests, anything at all, like topics that you want to hear more about, or just like broken down in an easy to understand, funny way, we're open to it. Just message us in any form of social media or our email, funnymedicine305@gmail.com. And we will see you on the next one.
See ya.
Bye.
Bye.